Cancer survival has become a catch-all phrase to refer to living individuals diagnosed with the condition at some point in their lives. Now, cancer survivors are often neglected for other cardiac diseases which might be a serious risk factor. Hello and welcome to Medical Dialogues, your daily dose of health and medical news. I am Dr. Nandita Mohan, and today I'm going to discuss about childhood cancer survivors who survived cancer and are at a risk of cardiac diseases. Adults who survived childhood cancer have a higher risk of developing cardiovascular diseases than their general counterparts, yet they are 80% more likely to be undertreated for several cardiovascular risk factors including hypertension, diabetes, high cholesterol. This is in accordance to a new research that was published in the Journal of the American Heart Association. Previous research has shown that due to their exposure to chemotherapy and radiation repeatedly, childhood cancer survivors may face up to a 5-fold increased risk of developing heart diseases and even death compared to the general population. Multiple studies have shown that most adult childhood cancer survivors, they report receiving only general medical care, not specific to their experience with cancer. Previous research also suggests that cancer survivors are not receiving recommended cardiovascular screenings in a timely manner due to limited awareness of future health complications by their survivors and the healthcare professionals together. The researchers in the present study, they measured the blood pressure, lipids, glucose, hemoglobin, the A1C levels in nearly 600 adults with an average of 28 years after a cancer diagnosis and obtained similar data on a comparison group of nearly 350 same-aged adults without a history of any known cancer. It was found that cancer survivors were more likely than those without a history of cancer to have hypertension, abnormal lipid levels, and even diabetes. Participants in both the groups had similar rates of underdiagnosed hypertension, high cholesterol, and diabetes. However, cancer survivors were 80% more likely to be undertreated for these conditions compared to their study counterparts. Hence, it was concluded that serious heart disease is uncommon in young adults in the general population, which includes childhood cancer survivors. Therefore, greater awareness of the significantly higher heart disease risk when there is a history of cancer is definitely important. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.